Hello, my name is Amanda Stratton, and this is my presentation on drowning. Drowning can be silent. It can happen when there's lifeguards present or when they are not. It can happen in very little water or, lots and lots of water. It can also happen to the best of swimmers, no matter how advanced you are. But it is preventable. Here's a few quick facts about drowning. Drowning is the third leading cause of unintentional injury death worldwide, accounting for about 7% of all injury-related deaths. There are an estimated 360,000 annual drowning deaths worldwide. Global estimates may significantly underestimate the actual public health problem related to drowning. And children, males, and individuals with increased access to water are most at risk of drowning. Some of the risk factors consist of age, gender, race, the swimming ability, whether alcohol and drugs are involved, food in the stomach, place and location that the person decides to swim, swimming aids such as, swimming noodles, pool noodles, whatever you want to call them, tubes, floating pads, anything like that. Living near and around water, the flood disasters such as hurricanes that we've recently had that have devastated the South, and transportation on water, the boats, jet skis, stuff like that. This infographic to the left I thought was a good visual of some of the risk factors living around water. I thought it was interesting that there's a 43% chance of drowning in a pond compared to the 5% in a river and 7% in a lake. I had to really think about this because I didn't understand why a pond would be more risky than a lake. Because on a lake you have the boats, the jet skis, you have tons of people just enjoying their summer days, boating, fishing, swimming, anything like that. But then it dawned on me that ponds are more secluded, so there may not be so many people around the pond to help somebody in the event of a drowning. There are also preventative actions. So if you have a pool around your house or in your house, you can put locks on the doors, you can put fence around the pools, or a deck, something where small children and people who are not able to swim cannot get in, and stuff like that. The causes and risk factors for infants and children consist of lack of personal flotation devices that, we usually call life jackets, lack of supervision, swimming pools that are not properly bordered or fenced to keep children away, and child abuse and or neglect. The cause and risk factors for teenagers and adults consist of the inability to swim, having a medical emergency, alcohol consumption, fatigue or exhaustion, lack of life jackets, and lack of respect for the environment. That means basically if you are, diving in shallow water or walking on thin ice covered bodies of water, you have the chance to drown if you do not take the proper preventative actions. There are several signs of drowning, although they can be hard to grasp or to get used to, so you can be familiar of how to spot somebody drowning. If the head is low in the water and the mouth is at water level, or the head is tilted back with the mouth open, if you can see that the eyes are glassy and empty but unable to focus, or the eyes are closed, or the person has their hair over their forehead or eyes, if they are not using their legs vertically, if they are hyperventilating or gasping, trying to swim in a particular direction but not making headway, trying to roll over on their back, or if they appear to be climbing an invisible ladder. Those are all really good signs that somebody is having difficult swimming or staying above water. There are different types of drowning. There is near drowning, secondary delayed or dry drowning, freshwater drowning, and saltwater drowning. The near drowning is when the patient is rescued before the point of death or there is temporary survival. The secondary delayed dry drowning is drowning from fluid in the lungs that occurs not during submersion in water, but up to 24 hours after swimming or bathing. The freshwater drowning consists of when external respiration is interfered with by fresh water entering the lungs. The body will absorb the water into the blood. The pH in the blood is distorted, and the body can cope with small changes, but the larger changes may result in cardiac arrest, sometimes within 2 to 4 minutes of the rescue. The saltwater drowning is completely opposite of the freshwater drowning. Water is drawn from the blood into the lungs. The viscosity of the blood increased the circulation, which becomes sluggish, slowing the heart rate until the point of cardiac arrest. Cardiac arrest may occur up to 12 minutes after rescue. Some people want to know if there is treatment for the drowning victims. There's not necessarily treatment, but there are things that you can help to treat a drowning victim. First and foremost, call 911 if you are able to. Know first aid and be able to perform it. You should retrieve the drowning victim from the water. You need to assess the situation. If there's a neck injury, minimize movement of the neck. If the victim is not breathing and does not have a pulse, then you should initiate CPR if you are trained in it. If the victim is breathing, lay the victim on their side in case they decide to puke or, they don't exactly have the chance to not puke and get all over themselves. So if you put them on their side, it's easier to get that stuff out of their mouth, out of their stomach, and off of them so they don't drown in their own puke or suffocate in it. You also should seek medical assistance as soon as possible. The faster you get that drowning victim to the hospital, the faster chance or better chance they have for survival. I wanted to throw this infographic in here because I didn't realize how many drownings actually happen in the home. And I thought, with all these little people up here, it would be a nice visual for everybody to actually grasp the concept. So around 87 children under the age of 5 drown every year around the home, which adds up to 1 child every 4 days. And 80% of these drownings usually occur in bathtubs. There is safety and preventative measures that you can take. You can put barriers in place around swimming pools. Swim where lifeguards are present. Do not swim alone. Wear personal flotation devices. Supervise children at all times. Learn how to swim. Learn survival skills. And know first aid. I like this infographic because if you have a pool outside your home or even inside, here's some safety tips and some statistics. 20% of drowning deaths occur in children under 14, and 80% of drowning victims are male. 70% of adult drownings involve alcohol, and children ages 1 through 4 are the greatest risk for drowning. And like I had mentioned before, swimming lessons can help, putting barriers around, and supervising children, and using safety devices such as life jackets or tubes to float on, and knowing CPR and other first aid is very important and can help. I really thought this circle of drowning prevention was interesting. It says that you should always swim in a lifeguarded area. You should provide close and constant attention to children you are supervising in or near water. Fence pools and spas with adequate barriers, including 4-sided fencing. learn swimming and water safety survivor skills, and children, inexperienced swimmers, and boaters should wear U.S. Coast Guard approved life jackets. The discussion questions that I have posted, I figured, it might be easier instead of just asking one, I could ask a few, and then you could just pick one and then, post in the discussion on, the answer to the question, or if you have questions about the question, then we can go from there. So the 4 questions I came up with is there only one type of drowning? Or what are personal flotation devices? And then, in what ways can drowning be prevented? And who is most at risk to drown? This is actually a really interesting video. I had to watch it a couple times in order to really focus on what really goes on at a public pool if you're a lifeguard. I mean, I've never been a lifeguard, and after watching this video and seeing how many people are in this pool, I'm really not sure I'd ever really want to be a lifeguard. So I really have to applaud anybody who is a lifeguard who has been one, because this was actually difficult. I found this at spotthedrowningchild.com, and actually if you go to that website, it will show you a video of people in a pool, and if you spot the child drowning, you click on it, and it will tell you, yes, you're right, or no, you are wrong. But once you're right, and you found the drowning child, all this information pops up on what to do or how to avoid it. It was just a very resourceful website. So in about 30 seconds into this video, you should see the drowning child. So please watch. There's the drowning child. There's the lifeguard coming to rescue the child. Here is my slideshow with my references. And I really hope you enjoyed my slideshow. Thank you, and have a great day.